Etiefo hema mu nyinaa akwaba eba ya pomudin dwumadi a yato ne din Healthy Nuggets. Wei health lecture series a yɛbotaeɛ paa ne sɛ wo a wotie mi yɛbɛtumi afa so na yɛnam yɛn doctors akukudamfoɔ ɔmo ato ɔmo bo ase asua yɛn body system no ho na ɔmo abɛma wɔ adesua a wobɛtumi abɔ wo ho ban na watumi anya ahoɔden san sɛ yareɛ deɛ ɛyɛ o yareɛ ɛyɛ paa nti and I said for the past 2 weeks, no, Dr. Robert Okyere, no, and now all my edisuam, or your doctor near, on where cardiologist, a cardiologist, or more, or doctor, you know, a command one or that two in some ways, you on your massa. Yes, it's in the doc, ever my choir minu, you bet me alpha. So last week, Rebecca, yeah, you share heart failure, near ma, and ma, yakuma, no timija, if she will be, and also no, or the ever could different aspect, doc, me more kwaba.
Yeah, Agya Pastor.
Mpacho na abusuafo ho na wote sɛ.
Nyame adom obiara ho yɛ.
All
Pakyɛ
right.
obiara ho nso yɛ.
All right. All right. Yes, yɛ ho yɛ paa. Na ɛnɛ deɛ na ɔwɔ ma yi.
Pakyɛ na ɛnɛ yɛ discussion about the electrical system of the heart. Sɛ na ɔsi kan no last week na yɛ plumbing nti afei na yɛduru electricity ne so. Nti biribi kakra bi na yɛbɛhwɛ about that system from the heart standpoint.
Nti deɛ dɔk ɛka no electricity we nye ECG asɛm biara ne AEP asɛm electricity asɛm no yɛakoma no sɛdeɛ esi bɔ no bi wɔ m sɛ akoma bɔ pɛripɛripɛri no akoma a ne rhythm no ɛne ne bɔ no ɛmbɔ yie ne ho adesua ebi a wohwɛ mi wɔ hɔ a na so akoma bi gugugugu na ɛgyae ne ho adesua na dɔk ɛne yɛ ɛba abɛhwɛ no na afei yɛhu kwan yɛbɛfa so san sɛ akoma wɔ hɔ deɛ nipadua no ɛho hia ɛho ka a kyerɛ sɛ biribiara no ɛnkɔ yie nti dɔk ebio ansa na ebia dɔk ɛbɛtoa so no amoma yɛnkata yɛn anim na yɛmmɔ mpae yɛgya wɔ soro yɛda wase yɛsrɛ sɛ bra bɛka yɛn ho wabra wobɛnam wakoa mu akasa kyerɛ bɛmma yɛ nimdeɛ ne ntease a yɛbɛtumi afa so na yɛabɔ yɛakoma ho ban ne yɛ nipadua ho ban wɔ yesu din mu amen. All right.
Amen.
Sɛnea yɛdi kan ɛkae no wowɔ asɛmbisa bi a wobɛtumi de wɔ asɛmbisa no ato comment section hɔ yɛba a yɛde ho mmuayɛ ɛbɛbrɛ wo wohwɛ from YouTube a wobɛtumi de afa hɔ Facebook nso a wobɛtumi de afa hɔ nti dɔk afei deɛ megya akyire ama wo na watoa so.
Okay, that's a pan pastor. All right, nti mɛhyɛ my screen. Okay, very good evening to everyone again. This weekend so. This week here, this year about cardiac arrhythmias. And as I said, say Okumano peri. Now the main focus is electrical system. Kwaya Okumano electricity no isi faso juma. And some problems I to me experience from it. And a kwaya bit me first one. Now it's me born from that standpoint. In terms of Bible say it be bit share with others. Na yɛbɛtumi asua biribi nso afiri mu sɛ ɛbɛyɛ a yɛapɔmɔden no bɛtumi atu mpɔn na yɛtumi aboa each other na yɛtumi asom nyankopɔn so yie nti looking at kind of the outline of your discussion and then nti yɛbɛhwɛ the definition of arrhythmias no the various types of arrhythmias I heard the usual symptoms that are associated with different arrhythmias and I say electrical issues with the heart if I see diagnosis any acquire if I see manage arrhythmia. Now, you can say arrhythmia, there were many different types of arrhythmia. You can say you can about to see it must spend about 6 hours, but you're condensing or you try to say kind of very brief. But one term I use it for arrhythmia, a supraventricular tachycardia, an umbrella term. I cover all the different types of rhythms it's me kwasi akumano emanebo fast now it has a supraventricular then it's about last week you can say the top part of the heart your friend of atrium bottom part your friend of ventricle right and now you can say supra chese db above into supra and chese above the ventricle into you can about the top part of the heart and a tachycardia so chese akuma ebo fast usually normal heart rate near between 60 and 100 into heart rate near more than 100 your friend tachycardia into where akuma ebo faster as that you free the top part of the heart And when I say supraventricular tachycardia, no, it stands for again. It means say akoma no ebo faster, and I say a born 10 times than usual. And wasting so usually has to do with the electrical system of the heart. Now, sa akoma no say ebo fast. It be it may last from any period of duration. It may happen for a few seconds. It may happen for a couple of hours. It be more eba na ko. It be also the eba. It may last for a period of time. Now again, sa supraventricular tachycardia, and I say akoma ebo fast no. It's kind of an umbrella term. It's a broad term. Under that umbrella, no, there are different types of it. Into B, your friend or atrioventricular nodal reentry tachycardia. It means your friend or atrioventricular reentry tachycardia. And I say atrial fibrillation, atrial flutter. We different types, but I think say and maybe a bit about atrioventricular nodal reentry tachycardia, no, and maybe atrial fibrillation and atrial flutter. Because about it more in a little bit. But just to give kind of a quick overview, again, alluding back to the kind of last week, no, top part of the heart, no, a atrium, bottom part of the heart, no, a ventricle, into supraventricular, a again above the ventricle. It can say, kind of fast heartbeat, no, estatically the top of the heart. Now you hear command the generator, static electricity of the heart, no. Maybe you know the right, the top part of the right upper chamber of the heart, and I say the right atrium. Into a friend of side generator, a friend of the sinus node, and then a static electrical conduction, and I say electricity now. And only a static electricity now, now spread on the left side through certain wires. Into a static from the top, nanina I gather there is another kind of a pointer. Electricity na if free as no Nina go through this second generator and your friend no atrioventricular node and I say AV node. Into free na electricity no you I to say highway, right? I will exit. Into say electrical pathway no exit back to the right, not exit back so I go to the left. Into say electricity no again if free the top, now I call from the top no now I spread out the top part of the heart. Spread the qua, not top part of the heart, no, it's me a squeezy, right? If we honoma, not say electricity, na, but second generator, no. Now from the second generator, I cut to the bottom part. I cut to the bottom part, now bottom part, no, so it's me a squeezy. I pump blood, no, I call. Into sana kind of generally speaking, no, sana the electrical system of the heart is it here. Now you can say, I come above fast, no. You may to me cause it be ASAB instead of saying say electricity, no, free the top part, no. Na asperdia called the top chambers and sana basa main points no and sana call bottom part no it be honoma it's me drew point be a top part honoma na echo circles right and into your friend of re-entry chess are idea echo na echo back right in this example with that picture you on the right no electrical system now again I started from the upper right into the right atrium right so on a main generator on the wall instead of say a free honoma a beba to the second generator and I call the bottom part of the heart and it drew hanoma near circles near the electrical signals no it be echo right as well as the left side and it do also someone that it says send some of those fast electrical signals no to the bottom yes and command elbow really fast and it being so honoma the electrical system no it be more honoma munya an extra pathway right again, instead of say be free the normal, the upper right chamber, right, the right atrium, where some main generator one, and sana about the second generator, and sana about bottom no, it be more honoma or more another pathway, and that's another kind of a highway of electricity. Instead of say be free hanum, abba hanum, and sana abba hanum no, if free hanuma, or more another highway do a honoma and also fa hanum. Instead of there because natural, yeah, or extra bypass. And also to me cause ebo really fast. Into again, way kind of general overview of saying an electrical system of the heart, is working. Now, in terms of symptoms, amountfultimia from electrical issues, no, and you'll be unnecessarily experiences as symptoms, no. But common ones, lightheadedness, will be say, will feel very lighted, and I say dizzy, and it's super, no. Will be so honoma, no, will feel so abre, right? Obi nso wɔ hɔ no ma ofili sɛ ne ho mete and also or short of breath and obi nso wɔ hɔ no ma ofili some chest tightness. And again it makes sense because akoma no both fast in 10 times it means squeeze blood ni e ma ne call brain, right? E ma ne ntimi call body parts ni nti yes be ma oni so etimi brew and as be mo etimi feel say ho mete because that blood e oxygen no ntimi call baby e wo say call. But in terms of evaluation, for a coma above fast, and I say electrical system, no, some of the things I use here, electrocardiogram, and I say EKG, right? So call hospital, and I say clinic, a lead, the ball or chest, so I one may to kind of electrical signals. And I send electricity, no, a quite facility, AC course, a koi, and I say, be koi, and no boy made me who exactly what is going on with electrical system, no. Another tool I team using so you refer back heart monitor and no it's a portable machine ultimate ball. I know kind of and also so you will lead yeah attach it to your chest. I recorded kind of a heart rhythm. Every single come no electrical system no see and ultimate channel for a couple of days. We are now the outcome or doctor no reviewer at the cry course on as a contributing. Other devices to me using say a Fairbaco kind of event and as a loop monitor. And usually and also similar to say heart monitor, no? But I know if you want my to me the board chest and I see you to me implant not a record a heart rhythm no for a period of time. If you want for months or years. And as I look especially for loop monitor, no, say if you fast heart rate and as I come about first name who are the crop at the crop potting air course that it me places a loop recorder for a period of time. So now I'm me what the correct causes a fast heart rate now. And the last type of kind of monitor using your friend a patch monitor. And I had to say a small patch I the board chest and also record it or electrical kind of signals no. And also me who at the crop potting air course sa fast heart rate no say and on is a symptom and I say issue patients no have now we examples of the na kasa about into heart monitor no see look like into again I had to say device out to me the ball or lead no I the ball chest no a record the electrical kind of the electricity of the heart am I an idea of exactly what is going on and as a patch monitor no and I see a friend a Zio patch and yeah the ball chest then so to me I recorded some electrical signals I work in and an EKG and also leads I the ball or chest it might me an idea of kind of how I see echo from an electrical standpoint. Now, in terms of say yeah manage and I see you treat this broad term, no, so supraventricular tachycardia again a broad it will many different types associated with it. Say akumano airbo fast. It depending on which type of SVT and that's supraventricular tachycardia or right. Into akumebo fast no nima be bit ma cause into to say the can previously, all right. AVNRT and I say AV nodal re-entry tachycardia meaning say akumano instead of electrical system no echo from the top the main generator to the second generator and some are called bottom part of the heart now. It drew the second generator. There is another path we do and man called circles no. And no the treatment for no a little bit different. And we do some certain exercises be it me a cut it off some extra or fast heart beat now. It be a kind of so old boa and I say we'll break down. CBI to say they will have bowel movement. In say oh chem but I don't have a bowel movement. It's that pressure now. With me make it that pressure now. It's me enhance your nerves be on my it's me boa my heart rate ever down. It's oh boa and I say oh bear down and I say they oh chema and oh boa to me and my heart rate no it's me ever form. It be so on I will see you use neuro and some heart rate no it's me ever form. And it means so about very fast. It's because more blood pressure no form. In those instances, no, I will see a shock or more. The heart no back into normal rhythm. And then the last one, no, in terms of ablation, no, say yeah procedure. Na ya corner baby electrical issue no, no, yeah burning that part of the heart. Say the electrical issue no, in between a free honor. Now, just kind of going specifically, since you kind the two main forms of SVT, I because about again a AVNRT, again it stands for atrioventricular nodal re-entry tachycardia. Again, from the main generator, second generator, and so about to the bottom part of the heart, nama akomane squeeze no. It drew sa second generator na, na extra pathway bi wana say extra highway bi wo hono ma electrical system na efa instead of say be fa second generator no na fa another place na e corner ho round sa na e cause ma akomano, especially the top part of the heart and level really fast. Yes, and so to me cause some bottom parts of the heart and so able really fast. Na sa arrhythmia way. And I said fast heart rate it's me but suddenly, right? If you honma or ye be or go about a normal day. Not all of a sudden was actually kind of akoma ebo peri sa and if you honma e ba nen what me call and only the most common type of fast heart rate eba neko, right? Na this type of heart arrhythmia no it happen in kind of younger patients into the mean. So if you are patients when you some issue with this type of akoma ebo fast na or more average kind of age about 32 years into this one tends to happen in kind of younger patients. More experiences are palpitations and I say akoma ebo peri. And again, in terms of symptoms, I'm out for tie reporting is have palpitations and I say ufili sa akoma no ebo peri and I say ufili dizzy again because ebo fast no intimi squeeze blood ni obi so hon ma no homete and only a friend of dyspnea no and again since kan obi timi chest pain and I so ufili sa wabre again because heart no intimi supply enough blood to the body because it works so hard. Now, in terms of myoma, it may causes AVNRT, and I said this fast heart rate, especially in kind of younger patients. No, usually, in time any specific trigger. Will be it's me by randomly, right? It's me by randomly, near call. But some of the things and so associated, I bet me causes I'm gonna see alcohol, it's a more alcohol, no. And to me a factor to be predisposed to more moment to this kind of arrhythmia. In the basis in terms of using nicotine based substances and that's a stimulants. And so it to me cause extra heart rhythm, no. And sometimes kind of using caffeine, a lot of caffeine to kind of contribute to heart arrhythmia we AC. Now, in terms of say a point of in manage AVNRT, again, we under the umbrella term of supraventricular tachycardia, and I say SVT. Now we say sakomane bought that faster, right? Obi wo honoma na koma no ebo faster, e mane unstable, meaning say the blood pressure no is form. No, I get dizzy, no, I pass it out, right? In those instances, no table we basically the can say. So when the bad na say the blood pressure will form na or pass it out, you'll be to my and so over shocking, right? Or shocking the heart na bringing it back into normal rhythm. So that way I can want to be to me a beating. Obi so honoma, obi to my banana come on boy really fast, but no it's stable. None meaning saying the blood pressure no okay. Just that maybe I'll feel the heart no a beat fast and also feel dizzy. In those instances, our blood pressure near fine. It's me using neuro. I'm going to boy bring our heart rate down. And there are many different types of medications I use. I be about it in a little bit. But aside from say you use neuro, other maneuvers and so you be use specifically for heart rhythm way, right? If you say you can say about AVNRT now, and I say AVRT again, which is the nodal re-entry. It drew second generator no honoma na it trying to host instead of because second generator na from honoma trying to hold top one na my top part no able fast. Again, one of the maneuvers you use in a friend of Valsalva. It's Valsalva no basically the way I say which means we take a deep breath in, right? We take home in a very big breath in. We are not what cover nose. Not try to blow air out through your nose, right? We say a tough say what cover nose, but try to blow air out of your nose. The main point of this, you're saying, it's me and say other nerves, or body name, your friend or kind of parasympathetic nerves. That nerves we try a relax BB, try say bring the heart rate down. It is a human fast, not me we na me buamasa nerves bring the heart rate down. No, it me start to say it be a little bit more active. I know buama no heart rate no, it's me by form. And there's another form of it is your friend of modified Valsalva. basically the same thing, right? We take a deep breath in, now we hold your nose, now we blow out air no, through your nose. And whilst doing that, no, of course, you're going to kind of feel a lot of resistance because we know no air close now, try to blow air out through it. But oh yeah, no say we are, and I usually say, oh yes, savannah, we blow air now out. Better say be obey supine, and I say obey that a little bit flat. And you say be it's a picture we issue, you shouldn't be sitting up, kind of sitting up upright. Or so oh yeah, say be what that honum kakra. No way some maneuver no. If you want to no da honum flat. No page down 9 across 45 degrees. And only a friend of modified Valsalva maneuver. And also to me boy bring the heart rate down. Additionally, other things like to me a boy enhances hand nerve no. So that's parasympathetic nerve na. It to me boy bring the heart rate not down no. It be your friend or ice water immersion. It's be one more bit more fat buckets. Now, it be audience, so usually the temperature of the water, it will say between 10 and 20 degrees Celsius. And if you want to me find out what do you to yes, and also to me activities are parasympathetic nerve. No, the specific nerve, it's me bring the heart rate down. The front of vagus nerve, and no to me enhancing, now bring the heart rate down. Other kind of test to be I use to be a little bit more careful. You're about cochlear sinus massage, and once you massage one of your friend of the sinus of carotid vessels. I know your vessels supply blood to your brain. But I say we careful, say be any issues be our corona and see any issues in internal you careful. And by the two main things I to me you see as Valsalva maneuver now. Say what to honum either say all lie down. Now we'll take your breath in, we'll hold your nose, no blow air out through your nose. Now it's me bois and my heart rate no it's me form. Na another type of arrhythmia. Na you can say because about your friend of atrial fibrillation. And to remember, say you can say AVNRT no, the most common SVT, and that's supraventricular tachycardia, especially among young people. And atrial fibrillation no, overall in terms of say you can say about heart rhythm, and I say the electrical system of the heart, the most kind of common electrical issue you tie in. Now, atrial fibrillation, it may put a lot of patients at risk for stroke, heart failure, to say kasa about last week, and other issues, right? Now, basically, atrial fibrillation, they're trying to say, again, I go back to the kasa about now. Top part of the heart now, your friend of atrium, bottom part of the heart now, your friend of ventricle, right? Into the normal heart beat now, top no squeezy first, right? Electricity now, starting from the top. Into starting from the top, now I spread it to the top chambers, not top no squeezy. If we are not electricity now, I call second generator now, right? From second generator now I spread it I call the bottom part of the heart, right? The spread the bottom part of the heart and that bottom part is with squeezy, right? Into normal heartbeat now, top no squeezy, bottom no squeezy, top no squeezy, not bottom no squeezy. With atrial fibrillation or fibrillate means say idea air quiver, right? Instead of say be squeezing 9C now. Right? You say a quiver, and I say air fibrillate. And again, the top part of the heart is called atrium. Into the atrium or the top part of the heart is just quivering instead of squeezing normally. Bottom lady is squeezing fine, but top no, you say, right? Into means squeezing blood in a quiver, and I say fibrillate. It means my clots form at the top of the heart, right? And into them, it's me placing patients at risk for stroke. Now, atrial fibrillation, there are many different types of it. If you want to na ko, and your friend of paroxysmal atrial fibrillation, and I say AFib. No, because so the one need to be lasted for at least 1 week, and I say 7 days. Your friend of persistent atrial fibrillation. We just technical terms, and I say usually say AFib na lasted for more than 12 months, and I say a year. Your friend of long-standing persistent AFib. And I will be so one atrial fibrillation it just remains. In yes, doctor no any patients ne kasa no ma accept to say atrial fibrillation no be afa ho a enyi aka and your friend of permanent AFib. Now, just to talk a little bit more about atrial fibrillation, again, Stacey Kai, you started with lecture way, normal electrical system, main generator no the right upper chamber, the right atrium, and sana about the second generator, and sana a fasa branches no, and as I exit from the highway I call the bottom part of the heart, and some heart no squeezy. With atrial fibrillation electricity it started from the top chamber there are many different kind of other generators, small generators at what top part of the heart, and no one also starting their own electricity, right? Instead of say, be one generator starting electricity, now about bottom no, now my heart no squeeze no. Many different signals started from the top part into be a generators be bring or so on and no be a fire into be a fire sana na a mushroom no a ball really fast into yes top part of the heart no into me squeezy blood and my name cause bottom part of the heart into where kind of a picture where I will left to know you kind of an example na there are kind of different pathways it's me again, the most common place a time who say atrial fibrillation no on the right side of the heart, right? When a time who and based on that, so if you want to make certain procedures, if you want to make breaky, and I say I try to burn that part na it causes extra firing of electricity now. Now, in terms of symptoms, I'm off what I experience with atrial fibrillation. I say AFib now. Again, I'm off for if you say on a peri. And I say a fast. If you want to feel say or one man was skip a heartbeat. Obviously, so one man feel hey, right? Obviously, my coin to atrial fibrillation. I say AFib. Now, on feel any symptom whatsoever. Obi one cry just accidental. If you're a doctor, man a doctor examine no in the heart, ne heart. Now we say a command a boy in a funny way. Now doctor not picking it up. Into you be necessarily be symptoms. Obi one man a call out of sync a Caribbean started faster or Philippa say or chest pain or get say and any subrino or Phyllis or Baba pass it out. And I said no homete. Ubi so on honoma, Nidiana a ball funny. And I say or sa rhythm so on Philippe or names to be bisa el coso. Now Nyoma it me kind of contributed to say atrial fibrillation. And I said quite you bit me and that's bit me afaso abwa preventive obinya sa AFib no. So unya good blood pressure control an important step to take. So you'll be on alcohol so kind of avoiding and that's a limiting its use and so to be limit the frequency or your risk of kind of getting atrial fibrillation. Exercise always good. Since about 2 weeks ago no. Losing weight because excess body weight is so to be predisposed to say over have atrial fibrillation and I said this first heart rhythm. And also smoking so quitting smoking is always good. No business for honeyman from the thyroid. So thyroid no I will call hanum no a extra activa. It's me cause say extra stress. It's me my body no the system and I say sympathetic nervous system I know and my heart rate no it's me cholesterol no. It's me stimulate no and man it's me both fast and massa rhythm it's me it happen. And another really common issue it's me causes atrial fibrillation is sleep apnea. Into be one of that say uham chromo and that's what snore. During the daytime, we'll feel very sleepy. Also taking naps throughout the day because we'll feel tired. It's ABL for more and as ABL spouse a snore. And I say ABL in terms of risk factors, ABL weight was sure now snore. Important to get screened for sleep apnea. No, that's when here treatment. I've been here treatment now. So they be prevent you from getting heart arrhythmia way, and I say atrial fibrillation. Now, in terms of management, again, AFib no top part of the heart no emboye, right? Because emboye no mojano is stagnant, into me moving nicely, right? It gets stagnant, it me ma clot forming. Nasa kumano ko from say a quiver no to say a beat normal, not clot or honoma, a kumano a buy, a bit squeezy clotting it out, right? A squeezy clotting it out, a bit more cold brain, a cause stroke. A bit more nine, I see issues with your legs, and I say stomach, and I say anywhere, right? Now, one way it's me fossil, it determine your risk of stroke. No, you have to be chat mask. A calculator you use to your risk, your annual risk of stroke. Now, such chance mask, no, based on kind of say even per or history of heart failure, age. Usually, as age, no. Or risk of atrial fibrillation, so a cholesterol, a little bit more common in the elderly. Now, in terms of age, usually kind of after the age of 65, right? There are different kind of cutoffs in terms of the age, but I know you one modality, and I said gender, right? So your ban as a BMI or risk, a little bit different. And I saw a history of high blood pressure, history of stroke, and also when your heart attack da, and also what diabetes are, Nina come into play in terms of kind of say a boy who risk say when stroke. Usually for such chance fast can say or score more than 2 yeah, usually for such patients now you're here blood thinner. In those on chance fast care one no usually I will kasa uno doctor kasa about that risk no and then other things a bit more contributing. Na ni na a boy mate me make decision about whether or not he'll be here blood thinner. And I say a draw a bit me a prevent clots from forming so that be also bit more prevent a stroke from happening. Now blood thinners no the usual ones I tell you to a Eliquis and I say Pixaban. You back on your friend Xarelto, the other name a Rivaroxaban, and also warfarin, and also the other name is Coumadin. These are the types of blood thinners. You team use to emanate a thin blood no, and also prevent a stroke. And again, with atrial fibrillation, you can say a command on the top part, right, of the heart no, above fast, right? Into yes, moja into me squeezy. Above fast, you will know it use to emanate bring the heart rate down. And asandro the class near from beta blockers into beta metoprolol and as a carvedilol. There are other types of medicines and also class in front of calcium channel blockers. It be a diltiazem. I also see it use man bring this heart rate down. Any other medicines and also your friend of rhythm control. So rhythm control basically a try say a try say people heart rhythm no back in normal, right? But every medication has its side effect. And so it depends. There are many different factors I use to decide to say either say the patients number two rate control medication and as a rhythm control medication. And again, rhythm control being say and not try to say a bed maintain or heart rhythm no in normal sinus rhythm and as a normal rhythm. And obi so honoma oba inside atrial fibrillation no obi honoma no what me convert it back into normal rhythm, right? So what's atrial fibrillation na kuma no fibrillate a quiver na bossa peri na obi honoma no what me go from so all quiver no to back to normal on their own. No, because honoma here help either through a journey BSR rhythm control and I say cardioversion. Cardioversion is say yes shock right into the pads a terror chest wall no. Now you apply electricity now shock your heart no back into normal rhythm. Usually before say about cardioversion no it here so blood thinner so because your cardioversion and I see a shock a command yeah gets a little bit stunned, right? Into after the first month say a shock no or risks will be to develop a clot in the heart now yeah it was stroke currency and here so blood thinner so and sana yeah shock your heart no back into normal rhythm. And then the last time I beat my year for or more side atrial fibrillation ablation. Ablation HR say it made the catheters echo to the heart. Now baby abnormal electrical signals in the free band. It me burn it apart. So the be abnormal signals in the me free honum. Now hopefully patients in the me stay in normal rhythm. Now this is just an example of say about cardioversion and as shocking the heart now into the patch back aboard the right upper chest and the back also so and kind of the left kind of a mid-clavicular region. Now you're connected to machine no into and usually you say you see EKG against basically kind of EKG who the electrical system of the heart. Into send an EKG strip we see no one per chrono or atrial fibrillation CCI the heart rate no it was into the patchway a bona, right? Now say you me also ne shocking na hanum no would deliver shock no. Now one per will call back into normal rhythm, right? Into when you acquire facility, it's me shocking patients now back into normal rhythm. And then there's another type of rhythm, and I say arrhythmia. I am referring to atrial flutter. So that atrial flutter no is similar to atrial fibrillation. Again, atria, meaning the top part of the heart. Now we see, instead of say ABI compared to atrial fibrillation, multiple generators fire randomly, right? Now my accommodable fast. Atrial flutter, usually there is kind of a circuit or one area that was that top part of the heart and no it cause a problem. I no electricity no run it back and forth. And it's ma command no fast at the top. And only a friend of atrial flutter. But in terms of management, and a coin behavior even in terms of symptoms, patients in are very similar to atrial fibrillation. No? The only difference here, say, you'll be atrial flutter, you'll be one you use to bring the heart rate down, or to say metoprolol. No, it be more a little bit harder to control the heart rate with just medications in patients almost atrial flutter way. Now, in atrial flutter, typically, you tended to pursue ablation. And as I say, you honum na baby issue no one, you burn it apart, no, so the baby free honum no. And only the usual treatment, you try use it for atrial flutter. You bet me use it for both AFib and that's atrial fibrillation and that's AFib flutter, but usually the success rate, no, better in those with atrial flutter. And again, because atrial flutter, no, because usually localized to one specific area, it causes trouble. Into because localized to one area instead of multiple generators, no, a little bit easier. So you burn that area off. But aside from that, patients are more atrial flutter, so it's almost to blood thinner. So again, based on side charts vascular kind, based on risk factors are on the charts vascular, you see that now so meet appropriate criteria. Yeah, the water blood thinner to prevent stroke in the future. Into kind of again talking about cardiac arrhythmias now, there are many different types of it, right? But and then you can about the two most common one being the AVNRT or AV nodal reentry tachycardia, and I say atrial fibrillation or atrial flutter. And again, they all start the atrial fibrillation, atrial flutter, the top part of the heart, your friend on atria, right? It started from the top part of the heart, ABT irregular, right? A abnormal. It leads to some palpitation, and I say, oh, Felisa Wakumano, a and I say, peri. Now, the main risk with atrial fibrillation, atrial flutter, no, a stroke. It's usually the patient at all blood thinner, so to thin the blood, and I see the more to address so set a bit more slow heart rate in it down, so I'm too fast because about faster, commanding to me squeezy blood now more I feel dizzy, and I say more need to brew. And the other type, I'm sorry, about the AVNRT, I know I am more common in younger people. AVNRT is to me use neuro, but aside from neuronal, and also to me different types of maneuvers. This is how Valsalva maneuver. I know you take your breath in, you hold your nose, no blow air no out, no through your nose. And to me sometimes a bring heart rate no down. These are the two main kind of types of heart arrhythmias. You pass it about. Into more any questions? More feel free to leave it in the comment section. Again, yes, our email on your comfortable writing in the comment section. I'll be sending an email. Next time you be share, you be me and discuss it. Into the master for bomber.
All right. Doc, Nyami Inshaw. All right, Doc,
That's a
Nyami
pastor.
Inshaw. Oh, additional sonko a wode amaye sabre no you better have some few questions be now fe yede ene edi no aba eweye oka yes obi da no hwe ankromo obi da no hwe ankromo nipa bebre hwe ankromo pa ye nipa bebre o
Sure.
so yɛmfa obia wanasɛ obi a wotie me bia a ohwa nkrom no wɔyɛ at risk anaasɛ woda na wanda yie a wo position abɛda nso koraa tumi ma wohwa nkrom ɛno no mmienu no doc ma yɛhu deɛ ɛbɛtumi de
Yeah.
that way aba.
All right. Excellent question, Pastor. That's for this question. And in terms of even sleep apnea in itself, no, with this health lecture series, no, different types of doctors are hopefully say kind of one of the upcoming lectures, no, we'll have a dedicated lecture towards sleep apnea. But in terms of sleep apnea, usually or risk of atrial fibrillation or any low. Sleep apnea is actually one of the common risk factors in atrial fibrillation. In terms of say sleep position, I don't think say it contributed that much in terms of common usually would kind of the back part of a tongue, it may cause obstruction. Into from a flow into me flow into kind of sound no. And I've been so on my own feel wada, but I won't die. If we want we need to several times throughout the night, but we need to air it because nasa o back tongue of tongue now. It cause obstruction now honum into no oxygen into me koye. Into when it be 2 seconds, no asada, it be 2 seconds, no asada about you don't feel it. And into no more it be sorry no I just said the one that cry a bidre we honum 12 o'clock in nikum or so taking up kakra. Into idea and in addition to that, no other risk factors. See beyond prakonos are obese. The weight was show on your exercise and other risk factors a bit much see beyond prakonos sleep apnea. That's sleep apnea now important say check you out because it's bit may lead to stress, right? Last week, because about heart failure, no. The other type of heart failure, I say, accommodating to me relax, right? And to sleep apnea, a bit more contribute to that, a bit more contribute to that atrial fibrillation, or now your overall health, and so bit me, I'm a lot of problems. Into how I think say as spouses, no, yeah, get on your partner, so we get to checked out by a doctor. Now, here treatment, usually, yeah, treatment, your machine, your friend CPAP. And then the mawa it me a bone from let me be the back part of a triangle it me it be years and from now it me akoye nti o hwan krom important of the evaluate you.
I see, Doc. Yeah, that's it.
That's it.
Now, Nkromo ne if any say, I can see it looks as if the almost on the door na to say na so also be a chances so be Nkromo no ye higher na and I know you also
Right.
be a na to say.
Yeah, again, very good question. Usually, so also waiting was try. Yeah, the likelihood of what's we can chrome when I say what's sleep apnea, yeah, usually pretty high. And we can chrome is so there are different types of it, right? But your friend obesity hypoventilation syndrome, right? And it be so your friend is central sleep apnea. But so we obese and I say waiting was try or likelihood pass will be to me when you sleep apnea, no, usually it's a was true. And again, yes, I go back to last week. Yeah, cause about plumbing issue of the heart. Relaxation, no, we obese so and so start me affect the relaxation of the heart. Into extra weight, no, it's never good. It always adds just issues. Into I know you're very important. So it gets
No,
addressed.
yeah, me that see if the next question here, Obi Oha was say menya panic attack,
Right.
panic attack. Any Obi or wakuma yari na kuma ne bo pim no. Eba
Yeah.
better me who say we anxiety be na cause panic attack and na say makuma and no that difference no. You better
Yeah, again, excellent question, Pastor. Very, very good question. In terms of kind of making that distinguishing, no, a little bit kind of trickier. Panic attack, I think, say that enters the realm of psychiatry and a more different constellation of kind of science. Suggest to see will be a panic attack. Will be one of my more friend kind of a sensation of doom. Say, be a feel so but usually, and so hurry to so able faster. Even with my question was when you panic attack, right? Because you feel so home me home because akumano ebose moja no move until feel so by pass out when you brew. And also and I know by itself ultimately lead to panic attack. It's usually see people panic attack usually kind of appropriate so when you evaluate you, right? So but my EKG, making sure say or heart rhythm no BBI okay. Na appropriate physicians no bit me evaluate you. I make that decision CBI actual arrhythmia being a so and a maunya panic attack no and I say a actual panic attack in EBI Emma will feel that way. But say we'll make it that distinguishment no a little bit tough. I think say we'll hear kind of proper evaluation when that happens. And I think it's kind of yeah, since kind of some of the heart arrhythmias we do one man maybe an fast from feel say BB fast in T. Unless over cornea check your out now. If you one my heart say with me I can say a true panic attack and I say BB a contributed to that.
All right, yo, and you might give a bria, yeah, it's me wakuma buff fast. And
Right.
is it advisable? Maybe yeah, exercise wakuma no to me bon ten. One auntie come, you might give this hasana. Is it good for the heart? Say, or why it me activities be managed me bomb ten and where yeah.
Yeah, and oh yeah, right. In the exercise, no, kind of the appropriate response, right, should actually be say, oh yeah, exercise, and oh yeah, actually, oh yeah, healthy, no. Obi wɔ hɔ nom a ɔnsɛ ɔwɔ heart issues on ɔte kakra bi a na ne chest ɛyɛ ne ya. Ebi wɔ hɔ nom a yɛyɛ stress test. The point of say obi kɔ for stress test yɛ sɛ wobɛ stress on na wakoma no bɛbɔ fast. Obi wɔ hɔ nom bi a stress ne kakra bi a na ne heart rate no ɛkɔ really high. But stop here and aba down very quickly. And we are usually very good response in terms of kind of a stress test evaluation. And that's how we exercise. Say, obey now come on, it's me a costro. You find say be a walk gym now or treadmill so to America. Now heart rate you find say 60, but to America, but the highest ever call you 70. And what you say there's something off, right? Oh yeah, exercise now exert one. I was how come on, it was a responding appropriately, right? The way I see responding is say we exercise no. I will say a pumping more blood. So the baby oxygen rich blood, not me as a supply, right? Into the more exercise you do, the faster the heart rate has to be to supply enough blood to the rest of the body. Once you stop, it should come down nicely. Now we exercise maybe we na still wakuma no that's so faster. I know you separate issue. And I said, oh yeah, exercise wakuma no intimi call faster. And also a completely separate issue. No, your friend kind of a heart block. I know you be sometime in the future, you time you bit makasa about it. But I know they're good. We exercise also heart rate, no. It will say cholesterol. I know a good response.
Mm. All right,
Right.
Dr. Robert Okyere na ɛne no twetwe nkɔmmɔ ɛfa ɛyɛ yakoma ho. I know say for the past 3 weeks you want my disua bebree for yakoma ho, but and I'm saying be na yɛde this series no bɛkɔ na wie nti pɛ sɛ mesa busa other general questions aside ɛne de a wɔde ɛma yɛn. Ebi obi tie me sise ya na for the past 2 lectures nyinaa nipa na tie ɔpɛ sɛ ɔbɔ n'akoma ho ban. Yɛwɔ nnuane bi a wobɛtumi aka sɛ yɛdi a ɛboa yakoma anaa ɛyɛ na amanfoɔ ka sɛ dua bia fruit bia ne shape no yɛ sɛ akoma bia no ɛyɛ good for our heart. Asan sɛ nsɛm no yɛ nokorɛ doc.
Oh, a good question. I don't think so. Much evidence in terms of heart-shaped fruits, and I say heart-shaped vegetables better for the heart than other types of fruits. But a good, very, very good question. In terms of in a type from a heart standpoint, especially for more hypertension, be a friend of DASH diets. Some DASH diets incorporate different types of food that are low in sodium. And no bit ma abwa ama blood pressure no aba form. The other type of kind of it reduce your risk of severe heart attack. And I said diabetes, and I said bad cholesterol, and cholesterol from a Mediterranean diet. It is a Mediterranean diet. No, Google, you find kind of many different examples of it. It typically kind of includes woody grains, legumes. We use olive oil, fish, and nuts, and and on kind of studies on and no studies actually say to me have a significant impact in terms of say with your cardiovascular health. Into the two main types are usually Mediterranean diet and a DASH diet. Google I'll bring you a lot of information about those.
All right, Doc. Yeah, that's it. Now, my mom said this question. One thing on man for tire cancer is aspirin. Aspirin almost say good for the heart. In fact, back Obi Kwado was from the age of 50 the so when you're allergic to aspirin, or why so for baby aspirin.
Right.
I don't know
yeah.
Now
yeah. Right. Again, another excellent question. Pastor, you're asking fantastic questions today.
Thank you.
Now, aspirin, no problem. Aspirin, again, it depends on kind of the risk. BBI, you heard the risk and the benefit. Typically, it will be a friend of ASCVD, and you can about it during the first lecture, atherosclerotic cardiovascular disease calculator. And basically, you heard say ABL, in terms of CBL or diabetes, and I say cholesterol numbers, and blood pressure. Or here, now yes, calculation. I usually say risk more than 7.5%. I would say he has statin, and I say I drew for cholesterol. In addition, we will consider aspirin. Say aspirin, or in terms of using aspirin, there are kind of two different categorizations. But you use aspirin, your friend of BB primary prevention. Primary prevention is say heart attack, which is prevent heart attack. Would it be appropriate to use aspirin? In that case, you can say ACVD risk, say high, meaning say more than 7.5%. Now, only need any history of bleeding. When it's our patients, we have that discussion because we do a or ulcers on the stomach, and I say some bleeding issue because of pain. I will say, we'll consider that before so best to aspirin. And being so when you heart attack that, right? And you're from a secondary prevention because they've already had an event. It's when you heart attack that, and also when you stroke. And that's when you be sad, I know the one they have to be on aspirin indefinitely. But as primary prevention to prevent something from happening, you have to be a little bit careful, and we have to also look and see how high your risk is in terms of having an event. And based on that, one doctor will make a decision whether or not say aspirin will be good for you. But usually speaking, in terms of studies, for the elderly, meaning more than 65 to 70 years old, we'll use aspirin to prevent any events, and I say cardiovascular issues. The bleeding associated with it tends to be high. Again, you have to be careful in kind of patient crowd dealing with before so we'll be making that final decision on that. I hope
Mm.
say I answer a question.
Yes, yes. Nti that means we need to
Okay.
be very careful. Na yɛnhwɛ.
Right.
Although say it's good,
Right.
titiri
Right.
those situation ni bi wɔ hɔ a ɛwɔ sɛ wo take it doc. Nyame nhyira wo paa
Exactly.
na yɛwɔ duro
Yes.
baako bi nso a ɛyɛ very good amanfoɔ te aka sɛ wo
Uh,
akomayare bi ɛsɛ wotumi wɔ bi hyɛ fie, wɔ bi wɔ fie. Nitro. Nitro ɛno no
oh,
mini
okay.
bi a wɔbɛka ho asɛm kakra ɛno no sɛne ɛsi tie sɛ obi atumi tɔ bi obi a ɔwɔ akomayare bi atɔ bi tu ne dɛm anaasɛ te sɛ
Uh,
dɔkta sɛ ɛno no menim deɛ obi a ɔbɛka fa ho.
yeah, I think say nitroglycerin. And no, and there are different types of it. Maybe one of my friend sublingual nitro, and what you share under your tongue.
Mhm,
And if you saw one of my friend isosobide dinitrate, isosobide mononitrate. But usually I know you in right prescribing my patients maybe a more kind of coronary artery disease. Just say coronary arteries ne supply akomano with blood. Nti obi wɔ
mhm,
hɔ ma no blockages ɛwɔ saa arteries nim. Obi wɔ hɔ ma yɛn stent, yɛn different ayi but still ɔnante kakra bia no ɔnya chest pain. Nti
mhm,
sɛ ɛbɛyɛ a ebetumi aboa ama saa heart vessels no I relax ama mogya tumi flow very well no. And it's near prescribe some nitro no. So the
mhm,
baby minimize chest pain. And then minimize and I say a chest pain no the frequency of it no a cough from through cerebral arteries no are relaxing. In yeah usually unya so no Dr. Becca Sansa.
mhm,
Right, because again, adrenaline one a side effect.
mhm,
Nitroglycerin, the ABOB heart failure, especially on the right side of the heart, and yeah, you may taking nitroglycerin, a bit of my blood pressure go form. I'm one
mhm,
pass out, I'm gonna cause issues. And I
mhm,
say will be one or maybe I'll take key in role for EBI erectile dysfunction. If I say Viagra, we take Viagra, a contraindicated. You shouldn't be taking Viagra with nitro because a bit
mhm,
of my blood pressure call from
mhm,
into me, depending on the indication, reason to
mhm,
do to nitro in the first place. But I was saying one of doctor discussing sana wakoto nitro from anywhere because
mhm.
it bit me cause issues instead of helping you.
All right, Doc, nyame nhyira wo. Ɛba akoma ho nsɛm deɛ
Oh,
a ne sɛ yɛwɔ nneɛma bebree ana sɛsɛ kura nimdeɛ asa akɔ soro a motumi yɛ heart transplant wotumi kɔfa obi akɔ
right,
de bɛhyɛ obi deɛ
right.
nano nso maame bi kura papa bi a mehyia no yɛsɛ ɔmɔde sɛ akokɔ valve akokɔ no valve bi aba abɛhyɛ nipa deɛ mu ne nyinaa sɛ ɛno no tumi kɔ so wɔn.
Yeah. Now we say usually bovine, a cow valves na yeah Chinese. So but yeah, ni na
Valve.
yama right. You to use to at the end nowadays actually you also your bioprosthetic valves. How much you design it? How to replace the kind of valves. Nyoma a cost nowadays. Yeah. So nimgena there's a lot of kind of cool technology
Mm,
course in the field of cardiology. Maybe for the young audience, maybe more hands so no. Because may I advocate for cardiology because there'll be other doctors from other fields on the bar. But since
mm.
doctors, Pastor Sikan, I think the cardiology is the coolest thing. I'll definitely encourage you to consider that too.
All right. And then what the no so about to man na fi watch them ye. O party say obi wo med school na ope area bi ahwa omo nhwe cardiologist and so on.
Exactly.
Na say
Because
hono mo yes scarce na say the city hono is it difficult na obi wo ha osuro so
uh,
which you been out of mom.
yeah, I think the cardiology a very cool and a very fascinating. There's a lot of kind of in terms of anatomy, ability to be free, and physiology wise, and so saying you see is it happen, and how is it connecting your mind to body? I think say a very interesting and a challenging too. And in terms of say cardiologists, certainly there's always room for a lot more cardiologists,
Yeah.
especially kind of underrepresented groups now
Mm,
into a field that I think that there is a lot of opportunities. And in terms of the field now, which my from plumbing, to say the cast about last week with heart failure, which my electrician of the heart,
mm,
to say the cast about and which my interventional or person fix amount for a block, yeah, which me the stent. Yeah, which my kind of procedures. And being so on my cardio oncology, cancers of the heart, and I said tumors of the heart. Into and imaging, which my MRI, CT scan nti within cardiology no ɛno a yɛ whole field a nneɛma bituma sae wɔ mu na yɛ bebree
I
nti
see.
ɛyɛ cool and very exciting.
No, I mean, sure. That's say who was we say I know say why you why specialize it. Oh yeah, cardiologist. Ana also say
Yes.
ba ko bi aka ho no no yɛ deɛ plumber na emu de electricity we electricity emu de na so
Oh,
say ka ho no.
yeah, when you actually imaging, so when you cardiac
Imagine.
imaging, so yeah, cardiac MRI, cardiac CT, echo, sun one.
That is your plumber.
Yeah, I think so.
Plumber
You
of the
deliver the
heart.
no kakra.
All
Right.
right.
And
I had a
additionally,
member where I
yeah,
can ye de yakum edisia no nyina no aba awie. Said the doc a kind no doc aboye ma as I say doctors ahodo bebre no mo ebehia as time goes on no ewo eye dwumadi we eso bi mu ye Ghana for ebi mu nye Ghana for specialties ahodo gynecologists for beba different ones different fields. Everybody, don't miss this program. In fact, Bomodin a healthy nugget. Bomodin say baby and a bar benya beauty, which is what no one was so oh bushani be and also when you beauty, nay no yet me a boy on who by ye. Tidok memo bompire shashamai.
Pacho yo mompaye. Yene jawo sure that's all ben by waki na yo ho. That's all her so some privilege. As I may as about your health. You should say the issue ni we boy need me practice it. Na you bit my share with others. Na and I'm side yes so it's my boy improve your health. So they be bit me at my boy for ye. It's my song ye. You should so be kind of ho be shrine na until say be say shame be be sure be an abutai will be a wish will be a will be at me a draw home. Ɛda wase wɔde wɔama yɛn nyinaa wɔ Yesu din mu nti. Amen.
Amen. Amen. Medin Eddie Pastor Samuel Adjei and then Dr. Okyere ni share. Nyame ɛyɛ adom a brɛfofoɔ he bɛba na yɛasa atoa so. Until sɛ ɛbɛhyia mu bio no, ɛme mpaebɔ paa sɛ Onyankopɔn ɔmma wo apɔmuden. Bye bye.
Bye bye.